Well, thank you everybody for coming. My name is Sulek Harris, and I'm on the committee of the Australian Reiki Connection. And it's wonderful to have you all here for our discussion on the benefits of Reiki. And we've got three very interesting presenters, all of whom happen to be teachers. That isn't always the case, but on this occasion it is. And they will take you through some of their ideas and experiences around the benefits of Reiki. But in the meantime, I'd like to start with just a really short meditation, just so that we're all comfortable and receptive. And I don't know about the rest of you, but I like to actually have my hands on myself in a bit of a Reiki connection before I start meditating. For me, that's a really wonderful way to involve the energy in terms of my own meditation and Reiki practice. But obviously, you can do whatever suits you and is comfortable for you. So, all I'd like to suggest is that you breathe deeply and easily and feeling comfortable and grounded in your seat. And with each breath that you take in, consider what Reiki has been to you. Think about what a blessing Reiki has been in your life. Feel the sense of the energy as it fills you and it surrounds you. And keep breathing easily and deeply. And as you consider the blessings that you receive when you do Reiki for yourself and for others, you might like to think of the other side of this wonderful gift from Mikao Usui. And those are the precepts, the philosophy behind Reiki. The capacity to put your worries aside. The capacity to release anger. The capacity to feel gratitude. The capacity within yourself to honor your elders, your teachers, your colleagues, your neighbors, your friends, your children, all those that you can learn from. And perhaps the underlying essence of all of these was the final precept about compassion to all living things. The capacity to feel loving kindness towards others. So just ponder those blessings for a moment. Feeling comfortable in your seat. Feeling calm in the presence of Reiki and these other like-minded people.
Yeah.
So bring your awareness back to yourself, back to your seat.
Thank you. Yep.
Okay. So welcome again, everybody. Thank you. We've got three wonderful people to share with us this evening. And the first cab off the rank will be Linda Emsley. So there's a nice little bio there that you can see on your screen about Linda. But for those of you who are not wearing your glasses, if you need them, maybe you don't. Linda was involved in marketing for a long time, but over a decade ago, she changed quite significantly and became a massage therapist and a Reiki master. She's an author, a practitioner, a teacher, a mother, and she knows firsthand what the benefits are and the experiences are of living with Reiki, especially when there's the challenge of a condition such as fibromyalgia, which I know from my own experience in clinic is a very difficult situation for a lot of people to live with. So I am really looking forward to hearing what Linda has to say. And Linda, welcome from Darwin.
Thank you. I feel like I should say I'm not the last cab to Darwin, but perhaps the first cab from Darwin. And thank you for that beautiful opening, Sue. I'm really feeling the benefit that Reiki brings me, which is absolute softness. It's like a soft place to land. And I think that's one of the most powerful benefits for people who are managing chronic illness, is that it provides a beautiful buffer, safety net, and softness in a life that is sometimes feeling really hard and hard done by. So the things that I really wanted to address about Reiki for chronic illness cover 4 main areas, and they deal with the things that people with chronic illness often experience in common, no matter what that condition is that they're dealing with. Most chronic illness has some form of decline in it, some form of debilitation in it, and they're usually long-term, even lifetime. And the overall effect of that is it reduces people's choices. It makes you feel like you no longer really have much control over your life. There is a sense of loss, a sense of grieving, a sense of loneliness. It can be quite an isolating experience. And for these reasons, Reiki is just a wonderful gift to give yourself. So as you can see on the slide in front of you, I've broken it down into things that most people who have dealt with Reiki are already quite familiar with. So we know that Reiki is a safe modality to work with because it doesn't involve ingesting any other substances or medications or remedies. It can be delivered while you're fully clothed. It's a gentle placement of hands. There are some practitioners who prefer not to touch the body. And we all know that Reiki can actually be received at a distance. So for someone who has a chronic illness and finds mobility an issue, you can actually receive Reiki in the safety and comfort of your own home. You could even be in your own bed. Over and above that, when you're dealing with chronic illness, there's often a number of different treatment protocols or medications that may be a part of your self-care. And these can actually rack up and start to be expensive. And that's where Reiki comes in as being quite inexpensive, a beautiful, inexpensive tool to add into the mix. So that's the safe and inexpensive aspect of Reiki for you. And then, of course, there is how does Reiki actually make you feel in your body? It's well understood that when Reiki moves into the body, it actually has a beautiful calming effect on the nervous system, often switching us out of that flight-fight reflex and into the autonomic nervous system where we rest and digest. And this is a hidden benefit, I guess, of Reiki, in that when it shifts the body into that rest and digest mode, that's actually when our body is doing its best healing process. So in this place, we give our body more opportunity to take advantage of the healing work that we're actually doing, whether that be through Reiki or other modalities that you're working with, or whether that be with the medication and the medical protocols that you're working with. So there's kind of a double whammy there with Reiki. Over and above that, it actually relieves stress beautifully because of that function of switching the nervous system. It alleviates pain, and over time can actually create a sense of beautiful peace and well-being that relieves that sense of loss, depression, sometimes the anxiety that goes with a long-term illness. Reiki is a beautiful alleviation for these particular symptoms. So for the restoration of peace and well-being, a daily dose of Reiki, I highly recommend it. Slavitsa, I'm ready for the next slide. Thank you. Okay, now this is a really, really powerful benefit of Reiki, is that anyone can be a Reiki channel. You don't have to be special or have some hidden gift or talent to be a Reiki channel. Anyone with an open mind and an open heart can be attuned to Reiki. So this makes it a really useful thing for someone who is managing chronic illness, because you can get yourself attuned to Reiki and then you can give yourself Reiki every day. So it's not going to cost you anything at all. You don't have to go and see another practitioner regularly. You can be treating yourself. You can be receiving the benefits of Reiki every day for yourself, and you can do it more than once a day if you choose. So I highly recommend, if you're dealing with a long-term illness, that you get yourself attuned to Reiki and really ramp up your own self-healing process by giving yourself Reiki every day. And of course, the other added benefit to becoming a Reiki channel is that you now belong to a beautiful, like-minded, open-hearted, gentle, loving community, and that we get together regularly to practice our sharing and our gifts. So this in some way goes to alleviate some of that isolation factor that people with chronic illness can experience. So hopefully I hope you can see through the 4 areas that I've shared the benefits of Reiki, particularly for someone who is managing a long-term illness. Thank you so much for your time.
That was really, really lovely, Linda. And I just realized then that when I was doing the meditation earlier, I naturally fell into the concept that people who are listening here have all done Reiki, and that may not have been the case, but hopefully the principles behind it at least would have resonated, even if they weren't channeling energy for themselves. Hopefully they were feeling the energy from the rest of us. So that was lovely. Thank you very much, Linda. Appreciate that. And we've got Pamela coming up next. Now, we might want to go back to the bio slides, Levitsa, if that's okay. So that people can read a bit more about Pamela. Now, Pamela is in a different part of Australia. And whereabouts are you, Pam?
I'm actually on the central coast of New South Wales.
Right.
So okay. It's just north of Sydney.
Yeah. Okay. Well, I used to live in Point Clare, so.
Oh, okay. Just across the water from me.
Yeah. So I'm fairly familiar with that area, and it's a rather pretty part of Australia.
Yeah.
So it looks as though you've been doing Reiki for a very, very long time, having started at the Nature Care College in 2004, which is nearly 20 years ago now.
Coming up to it, yeah.
Yeah. And you've been to Japan and Mount Koriyama, which is quite beautiful, and it's on my bucket list of places to go. And you've had a home-based business where you've been offering Reiki to others as a practitioner. So that's pretty interesting as well. And you mentioned some other modalities. I think one of the things that I like about Reiki is that it's flexible enough to be used in conjunction with other modalities, but equally it is a full and complete system in and of itself too. So it's a pretty interesting thing that we work with, this form of energy work. Anyway, I would love to hear more about what your take is on the benefits of Reiki, and I suspect everybody else can't wait for you to start too.
Oh, good. Thanks for that, Sue. And again, I echo, thank you for that beautiful meditation at the beginning. I think, when you're not used to speaking and doing these things, it's a beautiful little boost. And, as I mentioned at the very beginning of our talks, or the very beginning before we started today, was we all sent Reiki to tonight to make it a beautiful experience for everyone. So again, because we're all speaking about benefits of Reiki, I just wanted to throw a little bit of indirect benefit as well. So one of the points here, it's a pleasure to receive it, give it, teach it, and practice it. And I have found, it sort of hit me one day when I was actually teaching a class, that, oh, wow, just everything about Reiki is really special and it really feels good. I don't massage, but I could imagine that sometimes if I was a masseur or masseuse, I'd go, oh, gosh, I don't think my hands will cope with it today, or the standing or whatever. And I'm not saying anything against massage. I think that's me personally rather than anybody else. But, with Reiki, it just is beautiful to give it. It's such an easy thing to give. I know when I'm on the receiving end, whether I'm giving it to myself, but better still when someone else is doing it, it feels beautiful. I know what's going to happen. I don't have to worry where they're going. I think Linda had put something about, you're clothed, so you're not worried about your bits and pieces. And teaching it, oh gosh, I never get sick of teaching it. I haven't taught as much since COVID, but certainly that's its own joy. And then, of course, practicing it anywhere, like I've just had the most beautiful experiences with animals and friends, if someone's talking or, having a difficult time, just putting your hands up and sending the Reiki, whatever they're doing, say it's presentation or whatever, that you can tap into it, which is great. So it just feels great, any part of Reiki for me. It's portable. So, these are all you need, which is great. I mean, you can have, and certainly, I might have some beautiful oils on or some music on or all that sort of thing. But, you can just give it anywhere at any time. And I think that's pretty special to be able to do that. And certainly I have, I've done it up in the air on a plane, all sorts of transport, all the hospitals and whatever. And so it's so good. I don't need to take anything with me. So I think that's a beautiful part of it. I'm actually working under the NDIS and doing some relaxation or meditation is my background as well. And, often if my clients who are quite severe, cases under NDIS, if they're really having a hard time, I can just put my hands up and give them a little bit of Reiki to add to the meditation. So it works, as Linda said, it works really well with lots of other modalities. And sometimes, both of us tend to go into what I would call an alpha state. I'm not too up on those things, but I certainly know that I go into that space of relaxation too when I'm giving it, and I come up with great ideas, or something comes up with great ideas along the way, or solutions, whatever it might be, but it just sends you into a beautiful state. Again, you don't need to spend a lot of time doing courses. You can just do Reiki 1 or Reiki 2 deepens the practice, and the symbols then come into the makeup as well. And of course, teaching it. And again, they're not all very expensive courses. Many of them are over 2 or 3 days. And it really is a beautiful experience. It's probably the funnest, best, most relaxing course I've ever done. And I would think maybe some of my beautiful students would say the same thing. So, Slavica, would you mind turning the next slide?
Yeah.
So nothing to judge or compete. We're in such a dog-eat-dog world, and it's so nice to be able to just do something. And you don't have to go, I wonder if I'm better than them. Oh, my hands are cold and their hands are hot, so maybe they're better. You don't even have to do that. As long as you're attuned, you can do it. And so you don't have to worry about that. For me, that gave me confidence straight away as well. I know some people struggle a little bit with the confidence, but I started teaching pretty soon after I became a master, and that's a little bit unusual for me because I tend to be a little bit unconfident. Self-healing, protecting your boundaries. I think it's absolutely vital for people that are doing work like, for instance, massage or whatever, or some of the caring professions, to be able to protect your boundaries, which you can do beautifully with Reiki. And of course, it just helps you come home to yourself and remember who you are. There's a beautiful book by Francestina that talks about that. And I think for me, that is ultimately the greatest hidden benefit for me for Reiki. So thank you very much for listening to me, and I hope you enjoy the rest of the presentations.
Well, thank you, Pamela. I think probably a lot of us who have been doing Reiki for a while resonate quite well with what you've said, and hopefully those who haven't been doing it for very long or perhaps are still just considering it will realise that if we can still feel that way after a long, long time, then chances are they can too, and that's got to be encouraging for all of them. So thank you for that. I really appreciate that input. And last but not least, so if we can go back to the bio slide, please, Slavitsa, we've got Samantha Avery, who I happen to know is down near Sydney, on near Neutral Bay, if I remember correctly, which is another beautiful spot of the world on the New South Wales coast. And so Samantha's been doing this for some time as well, since 2006, and she's passionate, which I've gathered from just a couple of times where we've had interaction, absolutely passionate about what Reiki can do for yourself and for those around you. And I'm looking forward to hearing more about what she has to say, because she's been a speaker about a number of these things for quite some time. And I know that she's got information about how the allopathic medical side is now finally beginning to embrace Reiki a little more than in the days when I first started doing Reiki, and it was all about hoo-ha and BS and Reiki doesn't work and all of those kinds of dismissive comments by various doctors and scientists. So it'll be interesting to hear what you have to say, Samantha. Thank you for being here.
Very much, Sue. It's great to be here, and thanks for the beautiful meditation. I echo Linda and Pamela as well, and thank you for your slides also, Linda and Pamela. Reiki, obviously I'm very passionate about Reiki, and I think this is a really, really exciting time to be exploring Reiki, whether you're a practitioner or a recipient. Reiki is becoming very well known now, and this is wonderful. It is in more demand year on year, and it's now being offered in hospitals across the world. So this is absolutely exciting. There are hospitals in Australia, UK, US, Mexico, Brazil, Ireland, and many more. And a lot of patients are looking to have that pre-op, during op, and I'll tell you a little bit more about that in a moment, and post-operative Reiki. They're having Reiki in children's hospitals, in emergency rooms, in oncology is very popular, especially when we can't be touched. You know, it's hands-off healing is amazing for oncology. And cardiology, we're getting Reiki in open heart surgery in the US. Reiki in orthopedics, internal medicine, that's really complex issue, and palliative care. And palliative care, my own personal experience in palliative care, when my mom was in ICU on her last couple of days, filling the room with Reiki in ICU. She was 90 years old, came out of a major surgery, and giving her Reiki, just filling the room with Reiki. She had no sedation, and the medical team were astounded that she needed no sedation or medication or painkillers at all. She was just filled with Reiki in the room. So it was quite outstanding. We have, if you'd like to go to the next slide for me, please. Thank you. I wanted to highlight the hospitals in Australia. A lot of people don't realize that Reiki is in complementary therapy clinics within hospitals. And the Mater in North Sydney is one of them. We've also got 4 in WA, in Perth, Fiona Stanley Hospital, the Charles Gairdner Hospital, St John of God, and also in Tasmania in the palliative care unit there as well. In the US, there's 800 hospitals and clinics in providing Reiki, and it's rising. And that also includes the top university hospitals. Now, that's really exciting for us because university hospitals really do set and pave the way for other hospitals to take on board the extra care that they give in their patients. In the UK, a very exciting charity called the Sam Buxton Flower Healing Trust. And they've got some beautiful videos of giving Reiki in hospitals to children's wards, but also to their families as well as the patients. And they work very closely with University Hospital London. They've actually trained 35 medical Reiki practitioners and have placed them across the UK. So it really is widespread. Go to the next slide. And what I'm really excited about is to hear what the clinicians say about Reiki. So we know as practitioners the absolute spiritual benefits it gives us, relief of stress and clarity it can give us, and how it attracts many beautiful people, like-minded people, where we feel very at one with each other. A few years ago, I had the opportunity to be the co-host of an international summit by the Reiki Rays International Healing Summit. So I highly recommend checking that out each year. And on that year, I had the privilege of speaking to the top breast cancer surgeon called Dr. Sheldon Feldman. He's the top of his league. He's been having Reiki, medically trained Reiki masters in the OR with him for 20 years. So this has been going on for quite a while, and it's increasing more recently. He got introduced to Reiki by his sister. His sister sadly passed away with breast cancer in her 30s, and he saw how she really benefited from the support emotionally and releasing the stress when she had the Reiki. When he witnesses the Reiki practitioner or master in his operating theatre with his team. Now, these surgeons are at the top of their game. The team is the top of their game, and they have to be very logically minded, can't have any of their emotions involved at all. What he says is when there's a Reiki master in surgery, it's like it becomes a surgical temple. The surgical team are more cohesive. There's a calmer atmosphere about them. The patient receives less painkillers. This is massive in hospitals because we do have an opioid issue in terms of opioid addiction in hospitals. It's very difficult to come off high painkillers. So when patients have less painkillers, it's really good news for everybody involved. He also says that there is less anesthetic needed. They're working very closely with the anaesthetist on that time. And also recovery is a lot quicker as well. So we've got some great feedback from the clinicians. At Hartford Hospital, patients who received Reiki had less bleeding during surgery. Obviously, this is great. Again, less pain medication, shorter stay in the hospital. We know that we recover better when we're back safe home with our loved ones. So great response there. Also, the Brigham and Women's Hospital. They say that Reiki promotes relaxation. It relieves the stress. And when we're sick, when we're unwell, that stress, and Linda touched on that earlier in chronic illness, that the stress is really heightened, that fight flight is really heightened. So with Reiki, it helps to relax and it helps put the body in its optimum place to recover. And so they're finding that is great improvement. Reduces pain, reduces fatigue, and overall quality of life. We've also got another hospital quoting that the Cleveland Clinic stimulates the tissue and bone healing after surgery. So this is really fantastic news, and supports the well-being of the client who is receiving the medical treatments. It stimulates the body's immune system and initiates a feeling of security, peace, and wellness, that whole sense of safety. and brings deep relaxation and reduces stress. And this is great feedback from top hospitals, top clinicians that are telling us that Reiki is real and it's having a really positive benefit on our physical body as well as emotionally as well. And what I wanted to sort of just share with you was quite interesting as a Reiki teacher, you know, with myself, Linda and Pamela, we all teach classes. And a few classes ago, I was doing a demonstration for Reiki healing. And this was in level 1, so the beginner's class. And there was a group of about 10 students. And after the demonstration, everyone's quiet when we do the demonstration. So we do a proper healing and the students are witnessing that. And after about 45 minutes of this healing, one of the students said that the pain she was having in her knee before the demonstration had gone. So when we share Reiki, we share it with the whole room. And she was still trying to find the pain in her knee, but it had gone. And she'd received Reiki by watching the demonstration, which was really exciting. And a month later, the same thing happened with another student. They had an abdominal pain and that had gone. So the benefits of Reiki on a physical level is amazing. There are so many studies. They say that Reiki is the most studied healing modality and also the most controversial because it's obviously reducing the need for medication or you know, the higher degree of medication and painkillers, which is obviously not great for our bodies. So I hope that's been of interest to you. It's certainly something I'm really passionate about, that Reiki is real and it does help our physical, emotional, mental and spiritual well-being, and certainly does embrace and attract really beautiful people to the energy. So thank you very much. And yeah, any questions I'd love to answer with everybody else.
Well, now that we are at the end, we will be throwing open the floor for questions. So thanks very much for that, Samantha, because I do a lot of work in clinical practice with people that have not only people who have physical issues, but predominantly people that have physical issues. And I can personally attest to not requiring pain medication after surgery. I was forced into having a C-section with my firstborn son, and I have no scar from my C-section. And the nurses kept saying to me, you don't have to be a martyr. You can press that pain button. You can have that drip with the painkillers, but I simply didn't need it. I was just doing Reiki on myself and I was out of the hospital in less than 24 hours, which is unheard of with a C-section. So.
Fantastic. That's a great response. And what a great example of how Reiki can reduce pain and also the repairing of tissue. Yeah, well, I won't show everybody that I don't have a scar. I think that would be taking it a bit too far. However, anybody that's got questions now, perhaps if you raise your hand and then Slavica can nominate whoever you are and you can unmute yourself and ask your question. Well, we have a question. We have a question in the chat. Do we?
In the chat. Yes, we have a question from Robert, and he's asking if he can suggest any practitioners near Pitamak in Moorabbin who could provide treatments for him. I think there is a way to find Reiki practitioners in the area, and I suggest you might contact me directly via email or ARC. There is ARC directory of practitioners in the area as well, which you can search. But there is definitely a way that we can assist you to find someone that's close to you. That's my answer. If anyone else has any other suggestions how to go about it, you're welcome to put your word in.
I think the directory probably is the first call, the first port of call.
Yeah.
Any other comments or questions?
Hi, Maya. I have a question.
Go for it. Maya?
So I'm based in Sydney, the Lower North Shore, and I noticed that one of the hospitals that were listed that were open to Reiki as a complementary modality is the Mater in North Sydney. I was wondering, I actually, like personally, would love to volunteer my time. So if I wanted to volunteer, do you have any guidance on how to approach?
Yes, to approach
Yeah.
them.
To offer it. Yes.
Fantastic. I would recommend contacting the Mater direct and ask to speak to their complementary therapy, their integrative clinic, and put you in touch with the people that organize the Reiki masters there, the Reiki practitioners there.
Okay, excellent.
Yeah.
Thank you. Yeah, I'm really excited. Yeah, thanks so much.
Let me know how you get on.
Yes, definitely. Thank you. Thanks, Sam.
Can I just mention to one of my students that became a Reiki master teacher later, she actually went to our local Gosford hospital and became part of their volunteer program. And it was actually in the orientation, they just mentioned that Reiki would be welcomed. And this is going back now a few years ago, and I'm not sure she's doing it anymore, but I could imagine that that would be in more hospitals, just not recognised yet. So I think if we infiltrate work, yeah.
I think that's a great point, Pamela. That's amazing. Approach your local hospitals. And when I spoke to Dr. Sheldon, I asked him the same thing. How do we get more hospitals taking on Reiki practitioners? And he said to speak to the hospitals, speak to the areas of complementary therapy and keep trying. I noticed with the Mater on their website recently, the last week, where they talk about complementary therapy, the first therapy they mention is Reiki, whereas a few years ago, even like 3 years ago, it would have been probably right at the bottom. So Reiki is very well recognized now. So this is a great time for us to share more.
I have a feeling too, they've also got it in their literature, the Cancer Council literature about Reiki as well. So it is getting out there for sure. Yay.
So we have another question in the chat there, Slavica.
Mm-hmm. Okay. Is it Subash is asking, is it possible to give Reiki through a photo of a person who is in overseas? And he's also Reiki level 1 for now. And also she is in ICU at the moment. So how would I be able to get her consent? And he thanks us for answering the question. Now, who would like to answer that question? Maybe Linda, would you like to answer that one?
On the surface of it, yes. Yes, you can give Reiki to someone who is not present with you. And it is a further connection that you develop with Reiki at the level 2 training. Sorry, I'm suffering a little bit of fibro brain this evening. I do apologise. Keep losing my words as I try to speak. So yes, and when you're in a position of not being able to get clear verbal consent, you can check in when you're doing the Reiki and notice, is the Reiki flowing? Is it okay for me to do this? You can get a sense of whether the person who you're intending this Reiki to go to is open to receiving it. If it feels like there is no Reiki flowing, then you can take that as being, no, they don't want that right now. And so you can call a halt to proceedings.
So Subash is level 1. So you wouldn't be able to do that, but can certainly offer positive thoughts. And the other thing that is possible would perhaps be to seek out a practitioner in the ARC directory, because to be a professional practitioner, you have to be level 2. I do a lot of distant absent healing with clients all over the place, including overseas. And when you can't get permission verbally, as Linda was saying, there's an aspect in the Reiki 2 connection where it becomes very clear to you whether that person is willing and happy to accept it, or is perhaps saying not right now. It's a bit, when you're not receiving a fee to do Reiki 2, it's no different to when somebody says, can you please send prayers or loving thoughts to my mother who's in a coma? Nobody thinks twice. Nobody blinks about saying, oh, but how do I get the mother's permission? But if you take a fee, as soon as that becomes a professional offering, informed consent is a must. So I just need to stress that as a legal compliance thing.
Yeah, that's a really great distinction and clarification. Thanks, Sue.
Can I add a little bit to that as well? When I gave Reiki to my mom in ICU, she did not like to have Reiki when she was verbal. It wasn't her thing. She was happy for me to be a practitioner, but she didn't want Reiki herself. So it would have been inappropriate for me to give her Reiki directly. So what I did was to fill the room and let her decide whether she wanted to receive that or not. So for you, Sabush, if just to check if the person that you're sending Reiki to would actually want to have that, I think that's really important. And then, as Sue's saying, that practitioner will be able to feel whether they're ready to receive it at that point as well.
Oh, thanks for the links, Levitsa. That was going to be my next suggestion.
I just thought, I just thought like it would be good to put it up here so people can access right now and save it for later. The Epsom Healing book, it's been going on for a while, and Andonia, our committee of management member and a secretary of ARC, she's holding those sessions every Thursday over Zoom. So if you want to participate in contributing to that distant healing for everyone who places their requests, you can join in and participate in that way, or you can go to this link and put in your requests so you're in the book. It's an incredible way to receive Reiki and to also send Reiki to others who need it.
So there's a question up there about mental disorders. So Reiki will do no harm. So technically speaking, there shouldn't be any concern about providing Reiki to someone with a mental issue of some kind. However, I've done a lot of work in my practice with people who have varying labels put upon their mental health. And I would have to say, I always consult with whoever their mental health care practitioner is first. And I talk about what Reiki has the potential to do. In fact, it can be quite cathartic and it can bring up old feelings for release. Now, if the person who's receiving the Reiki is unaware that that can be a potential response, that feelings can come up. And sometimes, for example, if it's anxiety and they begin to feel anxiety as it's leaving their body, they can become very frightened of Reiki and think it's the wrong thing and it's hurting them. Whereas in fact, it's a form of releasing. So I personally don't treat anybody in my practice unless I can have a discussion with it's with their referral and with their permission with their primary mental health care provider. And to that extent, I've also consulted with psychologists and psychiatrists about potential students, people who've wanted to come and learn Reiki for themselves, but where they had very complex. So I'm not talking about mild chronic depression, for example. I'm talking about quite serious mental disorders, including what used to be known as multiple personality disorder and schizophrenia and things like that. It's very important that they understand how cathartic Reiki can be and how beneficial, because you wouldn't want someone to end up with a psychotic episode, for example, because a certain trigger occurred. And if you can liaise with whoever the mental health care provider is, you can find out what those trigger issues are. And you can just ensure that in the course of delivering your treatment session, or if they're attending a class, then you make sure that they're nurtured and supported in the way that's appropriate for them. So yes, you can. You can offer Reiki to people with various mental health issues, but it's the severity of the issue. And I would be looking into that. Mild chronic depression, Reiki is wonderful for boosting mood and making people feel warm and cozy and loved. And that's so, so important. For some people who are feeling isolated, it might be the only form of loving touch that they get because they have no family or no close friends or anything like that. It can be incredibly emotionally rewarding and freeing for them, and it's a wonderful experience for the practitioner. So yes, it can be done, but it just needs to be approached gently and carefully. And when it's a very difficult or complex disorder, then it really should be done in consultation with the main provider for their mental health care.
Thank you, Sue. Thank you. So do we have any more questions from audience?
Yes, hello. Hi again. I have
Yep.
another question.
Go
So,
for it.
if you had a client who is pregnant, do you take a slightly different approach in terms of how you treat them during the Reiki service? Because when I was in my level 2 training, this topic came up, and one of the students in my group, she had been practicing Reiki for some time. I think she was just doing this as a refresher with another teacher. She said something about not taking any clients, like if they were in the early trimester. And so I just wanted to ask, the Reiki masters here, what is your approach if you had a client who is pregnant? And I guess
I do lots of
different
pregnant
stages.
women.
Okay.
Lots and lots of pregnant women. No, there's no reason to not provide Reiki in the first trimester. Reiki will do no harm. If the pregnancy isn't going to proceed, then it won't proceed anyway, regardless, because Reiki will not interfere with whatever is for the highest, the highest good or the outcome. And so unfortunately, many women experience miscarriage, but Reiki will make no difference to whether there's an onset of miscarriage or not. But what it can do is, if there is a miscarriage situation, it tends to reduce the risk of requiring it reduces the risk of infection if it's not a complete miscarriage. And of course, they should always be encouraged to seek medical help. But no, I do lots and lots of Reiki with pregnant women. The main issue is blood supply to the fetus, so you don't have them lying flat. Of course, if they collapse on your table, then you need to prop a sheet or a folded towel or something under the right hip, because it rolls the baby away from the artery and vein that actually feed the placenta, and you want to make sure the baby keeps getting oxygen. And so you should always prop them up. But any of the other teachers or practitioners who've been working with pregnant women would like to make comment on that. I'm speaking from my personal experience, but also that's something that I received quite a lot of guidance on in my original Reiki 1 and 2 classes, because I was very lucky. I had very thorough teachers who were very experienced and well-rounded practitioners as well. So,
thank you, Sue.
Sorry, what I would just add with that, because my background is actually as a registered nurse, is that if they have had very difficult pregnancies in the past, I'd just go cautiously around that with the trimester. But I've never actually had a problem with anybody coming and having Reiki when they're pregnant.
Yep, me neither.
Yeah. And I wish I so wish I had known Reiki when I was pregnant with my sons. I certainly, oh gosh, they just had Reiki hands on them all the time when they were little, and I was learning, and it was a great way to get them to sleep, just by the way. And also another, like in other cases where I've had people that having difficulty conceiving again after the first one, and they've got that timing that they want to get the timing right to have the siblings close together, and giving Reiki to women. And usually I have found that they have a very big bleed afterwards. I mean, not so much a medical emergency, but a heavy period, and often fall pregnant within the next couple of months. Now, I'm not saying I'm curing or anything. That's been my experience when I have given Reiki like that. So again, I'm not saying go ahead and have Reiki because you'll have a heavy period and then you'll be able to fall pregnant. But this has been my experience. So I'd just be a little cautious if they have had difficult pregnancies. So
Just share about
Samantha, you have a share.
Yeah, I'd love to share a little story. So I used to be very cautious about giving Reiki to anybody who was pregnant. I wasn't sure until I became pregnant myself. And the Reiki that I had during my own pregnancy was such a relief to have hands-on, a relief for discomfort. My baby absolutely loved it. It would be dancing around in my tummy. It would just absolutely love it. And it was the most amazing thing I experienced. And then I was also teaching whilst I was pregnant. And I actually attuned my colleague who had twins. So our babies were in our tummies as I was attuning and she was receiving her attunement. And it was very, very sacred. And when I gave birth, my son had Reiki 2 hours after being born. They love Reiki.
Oh, babies love Reiki.
They
In
do.
utero, straight after birth, they love it.
Thank you so much, everyone.
Hand up.
Helen, go ahead. What did you want to share?
Yes, I've been Reikiing pregnant women for a long, long time. Lovely, lovely, lovely. Also had what we call miracle Reiki babies. So people with fertility issues. That's been gorgeous. I Reikied someone who flew to Canberra for a donor sperm age of 20 years ago probably. That was gorgeous. They sent me a card 18 months later saying, guess what, fantastic. I gave birth at the age of 37 and 40, had 2 natural births. The pregnancies were totally Reiki the whole time, and I had a Reiki person at the births at the family birthing centre. No medication, just did it. And those children love their babies, love their Reiki too. Love getting my hands on babies, and they just suck up the energy. So yeah,
That's beautiful.
my experience. Thank you.
Any more questions before we slowly come to the end? We have another 5 minutes. So if you, Linda, go for it. Unmute yourself.
Yeah, I actually have a question for Sam about Reiki in hospitals. I was just wondering if all of the Reiki practitioners that are involved in the hospitals, particularly in the US, are they all there on a volunteer basis?
That's a good question. I think it varies from hospital to clinics. I know in the UK they are being paid a small amount with the Sam Buxton Trust, and there is the need to pay our practitioners. And that was very much driven from the Medical Reiki Centre as well. All the practitioners tend to be masters, and they are then given additional training to work in the hospital setting. Yeah, but there's a mixture, and I think they should be paid.
What about the Australian hospitals? Because I know the Sir Charles Gairdner one was mainly volunteer, I believe.
Yeah, it's mainly volunteers.
For Reiki. Yeah,
mainly volunteers. I hope that's changing, but I'm certainly need to check that out. Actually, thank you.
Yeah, I think, it's wonderful that we're getting Reiki into the hospital, and it's wonderful that we have people who are willing and able to volunteer their time and expertise. But I think it's really important that we get the next step of actually having Reiki recognised as being valuable enough to pay for it.
I agree.
Yeah. Okay, well, that was just my little thank you.
Thanks, Linda. Thanks, Sam and Pam, for your time in answering questions and your wisdom and knowledge. It's just been incredible to hear from all of you and your very deep experience with Reiki. Does anyone have one last question before we move on towards the end? No? Okay. I might then share our last slide so we would like to just mention that on 17th of July, we have our next event, which is called Reiki Personal and Professional Practice. And this is another iteration of these events that we try to engage public and our membership of the association to exchange experiences. So put that in your calendar. You'll be notified at the time. And then we have one more in September where we really share our stories about Reiki. So keep your eyes open for that. And then final thing, we want to thank our panel members, Linda, Pamela, and Samantha, for their time, and to all attendees for joining in and asking brilliant questions. And yeah, that's it.
And Slavica, thank you for hosting, even though you're overseas and far away and supposedly on a holiday. I really appreciate all the technical expertise that you've brought to this and your enthusiasm and everything like that. It's just been really lovely. And I want to reiterate my thanks to our three wonderful presenters who have some really different and interesting and exciting things that they shared with us. And I appreciate that very much. And thank you to everybody else who is attending. And Robert, good luck with your radiotherapy. And hopefully you can find someone on the directory to help you out. So I think that's it. Thank you, everybody.
I think that's it. You can also, if you go to the ARC website, you can access this PowerPoint, which we're going to upload later on, and the recording of this presentation if you want to re-listen or find information. But feel free to contact ARC with any Reiki questions you have. We are always there to answer your questions and help you along. That's it.
Thank you so much.
Thank you, everyone.
Thank you.
Everyone.
Bye-bye.